It's my great pleasure to introduce you to two leaders in their field. We have our very own Dr. Richard Horton, editor of The Lancet, one of the world's most important medical journals, which is renowned for publishing research and analysis that influences healthcare, policy, and public health around the world. And then we also have Justin Webb, who, for those of you who are fans of the BBC, which are legion, will know your journalism. You're the former bureau chief for the US, for America. And then let me just put in a plug for Justin's great podcast, which is Americast, which I listen to, and you can listen to too on BBC Sounds from the worldwide headquarters, wherever that might be, Justin. I'm gonna get off screen here so that we can have this very important conversation between you both. Thank you for joining us.
Marcia, thank you so much. That's very generous, over generous to me, I think it is fair to say, because I'm joined by someone who genuinely is distinguished. And also, my God, Richard, you've been editor-in-chief of The Lancet since I was a child. I think you're actually younger than me, but you have been doing it for some time. You have an extraordinary innings, and you also, of course, and it is relevant that you've done it for such a long time because you've seen so much come and go in the fields that you cover, and that's why this conversation is going to be so enlightening over the next half hour or so. The title is The Crisis We Can't Separate, Climate and Health, the Crisis We Can't Separate. So I suppose, Richard, the first question is, why can't we separate it? What is it that links those two words together?
Well, thanks, Justin. Great to see you. And I'd just like to thank the host for including health as a dimension in this discussion. Human beings are extremely resilient creatures, as we see every day in our news, but we have limits. And actually, we thrive as animals within quite a narrow range of temperature. We're not all equally resilient either. Very young children, older people, are particularly vulnerable because their thermoregulatory systems, as we call them, are not as resilient as middle-aged adults are. Those working outdoors are particularly vulnerable to heat exposure. And certain groups in our society, because of structural factors, and I'm thinking particularly of women here, a large burden of heat-related stress falls on them more than it does on men. So, for example, the direct harms that come from heat on all those categories of people are leading to increased numbers of deaths every year. The instability in our climate that we see, I'm speaking from London, that we see even in our own country, are leading around the world to floods and storms and wildfires, which are in some cases destroying communities. The fact that that there is global warming is increasing the possibility, and in some cases the reality, of vector-borne diseases like dengue virus spreading from tropical climates into more temperate zones. The quality of the air that we breathe in many urban centres is getting worse because of fossil fuels that are used. The heat, as the planet warms, the heat affects agriculture, and so many communities suffer from food insecurity. And there's another dimension that often doesn't get very much discussed, and that's anxiety that gets provoked by the climate emergency. The mental health impacts are very high. And just in one issue that I know you talk about a lot on the Today program, and that's the political dimensions of migration. We hear these phrases in my country about stop the boats. I mean, we're not going to stop the boats because migration is one of the great forces of the 21st century that's only going to continue. And climate change is one of the forces that's going to drive more and more migration. So there are many dimensions to this that link health to the climate change that we are seeing. So it's a central issue.
I want to get back to the politics of it in a bit, but just to focus first on what you're doing, and specifically what you're doing at the Lancet, because you've got this countdown, haven't you? Countdown on climate and health. Tell us about that.
Yeah, so about 20 or so years ago, we decided that we wanted to do more than just publish research papers. We wanted to try and bring experts together who have particular specialist knowledge to focus on urgent problems in our society. And so we started in 2009 with our very first Lancet commission, which was actually on climate and health. And we then did a second commission in 2015, also on climate and health, updating the evidence. And the basic message of that work was that climate change represents the biggest threat, but also the biggest opportunity for human health in the 21st century. After we published the 2015 commission, we didn't want to just let that piece of work sit on a shelf or a computer. We wanted to continue it. And so we launched this countdown, which is essentially, it sits within University College London. It has an array of international contributors, and we produce an annual report that summarizes all the evidence on the latest developments in climate and health. So we're basically tracking what's happening in the health sector vis-a-vis climate. It's an annual report, but it's also an accountability mechanism to try and hold those with power accountable for their promises and commitments.
Do you feel it is increasingly or decreasingly successful in doing that?
Well, I think the honest answer is that it's a mixed picture at the moment. I think, and it would be a very fair challenge to us to say, has it made a convincing difference? If you look at the most recent report, which was published just a few weeks ago on Europe, for example, we've seen that there's been a decline in political engagement and media engagement on issues around climate and health. Most political parties in Europe do not have policies that link climate and health. And if you go out and survey the public, a tiny number, only about 3 or 4% of the public actually link climate and health in their minds. So we have a huge job to do in building awareness around these two issues. But I am encouraged that more and more people, certainly in the health professions, are now aware of the importance of climate as a dimension of medicine and health. And that is the basis for my optimism.
Are we in any way prepared then? I mean, you were referring to the situation in London. And I think a lot of people have been quite shocked, actually, by the last week or two in London. And it's a pretty grim day today for those who are not in London. It's sort of almost a normal. I think it's actually oddly cool today for the early June, but it hasn't been anything but. And those of us of a certain age very much felt, when you were talking about the impact on people at both ends of the age scale, reaching the latter end, I feel it more than I think I would have done even a few years ago. And there was a discussion, and we had it on the Today program, about air conditioning and about the need, and there was a report, I think, out about the need specifically to focus on hospitals, care homes, etc., etc. But more widely, is government, are policymakers, are we all actually as aware as we need to be of at least the threat, if not what precisely to do about it?
I think the answer to that is that it's very contested. It's a very contested political landscape. Those who would argue no, governments are not doing enough would say so, as I described at the beginning. The number of deaths from climate-related heat exposure are increasing. We're falling short on domestic action to address that rising heat. We're not adapting fast enough. We're still giving billions and billions of pounds in fossil fuel subsidies to industries that are literally strangling the planet. Our health systems are not prepared. Anybody who's walked into a hospital recently will know that that actually the heat goes up when you walk into a hospital. They are absolutely not ready for this increased heat exposure. And if you step outside of higher income settings like ours and go to Africa or Asia or small island developing states, they are particularly vulnerable. However, there is an upside, and I don't want to ignore that. Momentum is definitely growing. Countries are introducing, even though it's politically contested, they are introducing net zero targets. There are national adaptation plans. In the Conference of Parties, the COP that takes place every November, health is now a routine part of that discussion, so it's forced its way into the negotiations. We are seeing transition to renewables in our electricity supplies, and many cities actually, and the mayors of many cities are doing a fantastic job of greening their urban areas and trying to respond locally. So I think it's a mixed picture. Clearly there's a lot more to do. And we could go faster, but there are reasons, as I say, to be optimistic.
But I suppose the risk is, for you and for those who agree with you, that the broader picture, never mind the specific health issue, health and climate, but the broader issue of climate has become actually more contested in a sense that it was politically. And that is going to have an impact, isn't it, right across the piece, including on health.
Yeah, absolutely. And I mean, that's been one of my surprises. I thought that these issues were settled some years ago, and they're now absolutely part of mainstream politics. And some political parties now actively campaign on issues around climate in the way that I wish they didn't, more negatively. But I want to be clear about a nuance here. There is a backlash. The backlash is real. I don't deny that, but I think it's somewhat overstated. What is the backlash about? It's about the cost of transition. It's about how we deliver that transition. But I don't see now, like we did perhaps a decade ago, I don't see a fight about the science. But
that's very interesting, Richard, though, isn't it? Because that means that fight has to be entered, if you like, in good faith on both sides. Is that your view when it comes to what the costs are? And there are short-term costs, there's no question about it. And some countries do it differently. You think in China, they still have coal, a lot of reliance on coal as well as renewables. It's in a sense, it's that. I feel this on the Today program in our conversations about it. It's being real on both sides, really, isn't it?
It's been real on both sides. And I think those on my side of the debate don't always recognise this reality, because it's hugely expensive to go through this transition. I'll just give you one example, which is a bit local to the United Kingdom. But I remember before the last election going to a meeting at the LSE, and Ed Miliband was speaking about what Labour's, the current government's, policy might be in relation to energy, and he was absolutely clear that they were going to have a very rapid transition to net zero, a green economy, and it was super exciting. How is he going to pay for it? The answer that the LSE's economists had come up with was a massive wealth tax. We needed to have literally tens of billions to pump into government in order to pay for the transition. Well, look where we are now. That isn't going to happen. There's no way there's going to be a wealth tax of any kind. So this transition that we need to go through costs money, and we don't have the money to push it through as quickly as we would like. So this is where the concern is. Are we going to get to net zero by 2050, or is it going to be after that? The difficulty is that while we're having this political debate, the climate change, global warming is accelerating. In the past decade alone, I mean, this is a blockbuster piece of data which only was published this year, not by the Lancet, I might say, by another journal. But the pace of global warming has doubled in the last decade. I mean, we are now going through an unprecedented acceleration of the warming of this planet. And we don't know how to get out of this situation in the democracies in which we live.
Can I slightly alter subject now? Because another really important thing that you've been doing is championing this idea of planetary health, which sounds rather wonderful, actually. But explain, first of all, what it is.
Yes, so I'll tell you the reason why we champion this idea of planetary health. I used to go into the British Museum and see all these wonderful civilizations, Egypt, Rome, Greece. And of course, they were wonderful civilizations, but they're not with us now in the way they were. They're in the museum. There's no reason to think that our civilization won't end up in a future museum in 500 years' time, and people will be looking at images of what we're doing and be rather amused at our lives in 2026. The point is, societies come and societies go. And why do they come and go? Why do societies collapse? And it's complicated, but if you look back at past societies, such as the Mayan civilization, climate has often played a decisive part in triggering political crises or economic crises that society was then unable to navigate its way out of. So the concept of planetary health is the health of human civilizations. And here, by health, I don't just mean health as in bodily health or even public health. I mean the health of our politics, the health of our economy, the health of our society much more broadly, our ability to adapt to challenges that are thrown at us. And so that's one part, the health of human civilizations, and then the natural systems on which we depend. So it's trying to place the predicaments that we're facing, that we've just been talking about, in this broader political context. And you know, if you look at many Western democracies, the reality is the planetary health today is not that good, because we're really struggling to answer these questions and to find a path through them.
Yeah. And the state of the planet when it comes to any planetary anything, I suppose, really. I mean, we're even competing on the moon now, aren't we? Well, we, as the United States,
Mars,
and potentially Mars as well.
Yeah.
I mean, we don't have planetary government, do we? Far from it. And maybe we shouldn't have that. But do you see, what's the structure, I suppose, whereby planetary health becomes something that takes off and genuine progress that is measurable is achieved?
It can only come through cooperation between nations. And my worry, probably my greatest worry today, is that we're seeing actually a fragmentation of that cooperation. I had hoped, and I think I've proven to be utterly naive here, that after COVID, we would have realized that with 20 million deaths worldwide, we didn't handle that pandemic well, and we needed to work differently. In other words, instead of having 190 something nations working separately, we should have been working together to address SARS-CoV-2. We didn't do that. Lesson, how do we work better together? And yet now, the United Nations has never been weaker than it is today. We've got nations withdrawing from it. It's defunded, not just underfunded. War has entered the scene in a way that it hasn't for 30 or 40 years. So the picture for cooperation between peoples is looking pretty troublesome. I do feel optimistic, however, not at the government level, but at the people level. Just to take one example, people have a range of views about China and whether it's a good actor or a bad actor. But in my little corner of the world, which is health and medicine, we have intensely positive collaboration with our medical and public health colleagues in China, in terms of surveillance systems, in terms of building capacity to respond, for example, to another infectious disease outbreak. So I think technical cooperation between countries has never been greater. The problem is at that higher level, political collaboration.
Why is that, do you think? I mean, because you give the example of COVID, which is an extraordinary shock to individuals. Why hasn't that translated? Have you addressed that in your thinking about this?
Well, I wrote a book about COVID, and in the first year, and the last chapter was an extremely optimistic chapter, saying that actually one of the lessons we would have is that we'd all come and work together, and there'd be this, from the ashes of COVID, we would rise like a phoenix into a new era. Well, how wrong was I? Why? You know, it does come down to visionary individuals, leaders who are able to take an idea and translate it into reality. The birth of the National Health Service is one example. The inspiration behind the birth of the United Nations after World War II, the idealism there was right. But now we have, without naming any, some political leaders who are much more destructive, who don't want to see that cooperation. It does come down to individuals, unfortunately, and we need a new generation of political leaders who can express that desire for cooperation. You know, actually, and one of the reasons why I'm hopeful is that if you go back to Darwin, everybody remembers his first two laws, so to speak, of evolution, that you have to have diversity and then natural selection. But his third law of evolution was cooperation, that species have survived. The species that have survived historically have been those that have, at moments of crisis, have cooperated most effectively. And you know, the jury's out on human beings, on Homo sapiens. We don't know whether we've got the capacity to adapt to the crises that we face. I obviously hope we have, but there's no law in our DNA or anywhere that can precisely say that we will survive. And that's why I say go into the British Museum and you will see all these civilizations that didn't survive because at the crisis moment, they were not able to find that political leadership to find a way out of their problem. Can we?
Well, I'm going to give you an opportunity in a second to be optimistic, but can I just double down on the pessimism for a second? Because I mean, you're saying basically we're done for if we don't sort ourselves out, and specifically on the health issue.
I'm saying that we are living through a moment of accelerated global warming that is having tangible impacts on human health. That if we do cross 1.5 degrees, the Paris threshold, by 2030, which is now highly likely, and maybe 3 degrees by the end of the century, that is going to make large parts of our planet uninhabitable and is going to drive up, unless we mitigate emissions and adapt, is going to drive up the number of deaths and have a very, very big impact on our society, and on our economy and on our politics. And that's going to be a big threat to what we might call our civilization today. So it is the biggest challenge our species faces.
And to be, I mean, there have been strands of optimism in what you've been saying, strands where you think things are going in the direction you want them to go. But if you draw those strands together, and as you were saying right at the beginning, the psychology of this is important because people become depressed about our ability, I suppose, as a civilization, as a planet, to do the things that you say we need to do. But at the same time, we are incredibly ingenious, aren't we? And I think a lot of people think, well, somehow it's that ingenuity, quite apart from the other reasons to be optimistic. It's just human ingenuity And there've been separate sessions on AI, and it's there's quite a backlash against AI at the moment in the US, isn't there? And who knows what AI will actually produce in terms of benefits for us. But I mean, our ability to do things at scale, you see it in medicine, don't you? Our ability to do things at scale and to use the technology in a good way, it is still there, isn't it?
Oh, it is still there. I mean, 20 years ago, there were cancers that were impossible to treat. And now, with the advent of immunotherapy, we have a lot of people living in and working in our society who wouldn't have survived it if it hadn't been for those treatments. Look at diabetes. The new drugs that we have available for diabetes are making a real and tangible impact on the lives of people living with diabetes. So yes, we have incredible ingenuity. And a lot of people are putting faith in the idea that science will save us from this crisis. Will we just be able to absorb all the carbon dioxide in the atmosphere through some geoengineering solution, and we won't have to worry about global warming again? These are hopes, but I remain optimistic because the evidence base is growing. That's what the climate countdown that we do is trying to contribute to. Cleaner energy is coming and is being introduced into our society. And climate is now part of the mainstream political discourse. As contested as it is, it's there and it's not going to go away. And so now it's a struggle, and we're engaged in a struggle.
It's really interesting, isn't it? That last point about engagement is interesting, because there are so many. We live in a world, particularly in social media, in which people are engaged in individual struggles, as it were. Some of them positive, some of them negative, and it's up to them how they describe those struggles. But we, in a sense, we've become atomized in terms of political action. Someone was saying the other day on our program that the problem is that there is we're increasingly unable to grasp a thing that we used to call the national interest, and indeed the international interest as well, that we've been forced into by technology into a view merely of our own immediate interests, and that is also going to be a challenge, isn't it?
It is going to be a challenge, but let me just emphasize probably the most important reason why I'm optimistic and hopeful. I have a 25-year-old daughter, and she's in August about to enter the world of work. Her generation is so much more sensitized and so much more mobilized on these issues of the environment and climate than my generation was. I mean, when I was 25, I wasn't interested in any of this. And now her generation is acutely interested in it. So I really do believe that where people like me have failed, to be frank, her generation, I think they will succeed, because they have a very different way of looking at the world, a very different way of looking at each other, a much more generous view of each other and the diversity of their generation. And I think that generosity of spirit, that wish to be part of a global community and cooperating together, I think that's what will see us through, the next generation.
Dr. Richard Horton, such a pleasure to talk to you. Thank you so much. Thank you for your time and your insights. Real pleasure and fascinating stuff, and all the best for the next 50 years as editor-in-chief of the Lancet.
Thanks, Justin. Great to see you too. You take care. Thanks.
Bye-bye.
Bye-bye.